Why do some IVF doctors transfer so many embryos? We often see patients who've done IVF cycles in other clinics, and these doctors are routinely transferring two, three, four, even five embryos at day two or day three inside these patients, which is completely unacceptable because these patients run a great risk of a high order multiple pregnancy. Even twins are a complicated pregnancy because of the risk of premature labor. But with triplets, it's much worse. And then they do a procedure called a selective fetal reduction to kill one of the babies. Imagine the amount of emotional trauma an infertile patient goes through when you have to kill a baby which she wanted to get. And what's worse is, as a result of the selective fetal reduction, because there's all that dead fetal tissue inside the uterus, a lot of these women will miscarry at 20 weeks, which means they end up losing the entire pregnancy, all because this doctor was irresponsible and transferred too many embryos. The reality is, in good clinics all over the world, doctors transfer only one embryo at a time. And that's what we tell patients: have lots of babies, but one at a time. And ideally, this one embryo should be a top quality day 5 blastocyst because this maximizes your chance of getting pregnant. The problem is these clinics don't have very good embryology laboratories. They make embryos up to day 2 and day 3, and then they don't think these embryos will go to day 5, which is why they want to dump them back into the uterus as quickly as possible. They do this because their hope is that, chalo, at least one of these embryos will stick. And the problem with this is that when the cycle fails, they then blame the patient for the failure rather than accepting the fact that a day 3 embryo does not belong in the uterus. It either belongs in the test tube of a good IVF lab or the fallopian tube, but not the uterus. So please don't allow your doctor to transfer more than one embryo at a time.